Man, you can't trust white people.
Why can't you trust white people? Tasha?
Tuskegee.
Hi guys, I'm Katla. Welcome to my 21st episode. With the COVID-19 vaccine rollout ongoing in the United States, so are discussions about increasing vaccine accessibility so that everyone can get the vaccine, no matter who they are or where they live. However, what about the people who don't want to get the vaccine, who are vaccine hesitant? And I'm not talking about those who have been led astray by misinformation and disinformation and propaganda and all that harmful stuff. But what about valid fears due to previous practices by the US government and the current state of medical racism? Today I'm going to touch upon vaccine hesitancy in the Black community alongside medical racism in the United States by discussing the Tuskegee Syphilis Experiment. For those of you who are returning, welcome back. I am so happy that you are here, that you are subscribing, that you liked my previous episodes enough to come back and see me again. Yeah, I'm grateful for all of you. For those of you who are new here, please make sure to subscribe and turn on notifications as you won't want to miss a thing. I'm a public health communicator, which is like a science communicator, but I discuss the social issues, philosophy, and applications of public health in addition to the medical science basis of healthcare. I'm not a medical doctor. I'm not a public health expert. I am not a public health official. I study public health, and I just like talking about it and it raising awareness. So let's get into this. So the Tuskegee Syphilis Experiment has been discussed recently, but frankly, still not enough when you look at it from perspective of the decades and decades that it went on for and the decades and decades that we have since known about it. Part of what inspired me to make this specific video was an SNL sketch from a couple weeks ago.
Well, that sound means it's time for Ask a Doctor. This is where each of you get to ask me, the medical doctor, any questions you have about the COVID vaccine. And in the end, hopefully, someone will leave here with cash and take the vaccine. Let's start the clock at all day and go. Tasha.
Do it got syphilis in it?
What? Of course not. Why would it have syphilis in it? Tasha.
Tuskegee.
So for background, the Tuskegee Syphilis Experiment began in 1932, where free medical care was advertised to impoverished Black communities, specifically sharecropping communities, and 600 men were selected under the guise of free health care, but actually 399 of these men had syphilis and 201 were used as the control group. And the study was used to observe the effects of latent stage, secondary, tertiary stages of syphilis. So despite the study starting in 1932, it went on until 1972 and was only stopped once the details were leaked to the press. There was no plans to stop it at all. It was basically an indefinite study of let's just watch these men die. The men involved in this study were led to believe that they were receiving free health care from the CDC and US Public Health Service. Instead, they were given placebos, ineffective and frankly painful and unnecessary treatments, and they were never informed of their syphilis diagnoses. Of the 399 men who had syphilis in this study, 28 died from syphilis, 100 died from complications related to syphilis. 40 wives of men in the study were infected with syphilis, and 19 children were born with congenital syphilis. Part of the justification for this study is that the treatments for syphilis at this time were potentially more harmful than syphilis itself. However, in 1947, only 15 years after the study began, a cure for syphilis was found, and it's penicillin. However, these patients were not provided that medication, even though it was being widely given to anyone else with syphilis in the United States. Despite a cure for syphilis being discovered, the subjects of the study were kept in the dark and not given the treatment, and only given treatment in 1972 when the study was forced to end. Those of us studying public health and infectious disease, or practicing these subjects, or researching in healthcare, or really working with any type of research on human beings should be very well aware of this, as this study is part of the basis for informed consent being a mandatory process and such a controlled process now. Really, the most important thing we learned from this study is how harmful a lack of consent is when working in research, and we have to continue facing the realities and lasting effects of this study. One thing to remember when addressing medical racism in the United States is that, unfortunately, the Tuskegee Syphilis Experiment is not the only reason for minorities, specifically the Black community, to be hesitant of healthcare providers. We can't just use the Tuskegee Syphilis Experiment as a scapegoat for all the issues that we have in our healthcare system, and we cannot get complacent. We have to keep addressing the different issues we see, such as, just off the top of my head, there is the issue of pulse oximeters not working adequately on patients with dark skin as compared to pale skin. These things that they stick on your finger to check for your pulse and oxygen level. Additionally, there is an unfortunate belief that Black people can't get skin cancer. They can. Pain treatment is different between Black people and white people. A study found that half of white medical trainees believe that Black people perceive pain differently, whether this be due to thicker skin or less sensitive nerve endings. They are less likely to prescribe or provide pain relief for Black patients. There is the entirety of the maternal mortality crisis in the United States, which affects all ethnicities, but there's a significantly larger effect on Black mothers than anyone else. And then frankly, there is just plain old bigotry. Medical workers being racist to their patients and getting away with it. When looking at the entirety of medical racism in the United States, you can't really blame people for being hesitant of vaccines or just healthcare provided in general. You can't really blame people for avoiding preventive care, because while receiving preventive care will lead to better health outcomes, there's still the fact that harm can be done at these preventive care appointments in the first place. However, this does not mean that those of us that advocate and educate for healthcare should just give up in our efforts, as we still need people to be treated. We still need vaccines to happen. We need all of this. We still need to ensure that good and true information gets out there and will defeat the misinformation and disinformation. The path to improving healthcare and minority treatment in the U.S. is acknowledging and addressing the events that led us to the horrific situation that we are in today. We need to work harder, address our biases, and be better. That's all I have for you today. Please make sure to subscribe, turn on notifications, like, comment, share the video, and yeah, stay safe, wear a mask, get vaccinated, educate yourselves. As usual, there are links in the description below to work as a starting point, and from there you can hopefully find other resources and read to your heart's content. And yeah, I'll see you guys later. see. Still alive, and my heart rate isn't as high as I expected. I don't know, I get anxious when I film videos.